Hey, hello everyone. Hello everyone. Welcome to Pep Talks. This is the return of Pep Talks, and I'm really excited for today's little show. First of all, wherever you are watching from, let me know in the chat. I want to know where people are watching this from. I am, first of all, hoping that everybody is having a fabulous holiday, whatever holiday you celebrate. Weekend, month, whatever. There's lots of holidays this month, I think. I'm home in New York City and yeah, just I'm feeling really grateful. I know there's a lot going on in the world and in our country and all over the place. And I'm grateful for this time that I'm able to spend with everybody today. Pep Talks, for those of you that don't know, Pep Talks is a show that I've had for, hey, Louisiana. Pep Talks is a show that I've had for a while, and I brought it back and forth, back and forth, and I've covered all types of stuff. The last, like, long going version of it was a show that was called Pep Talks Black Movie Classics. And I brought folks on, my friends on, to talk about some of the best Black cinema that exists, I believe, in some of our favorite movies. And so that's not what we're talking about today. Today, I wanted to do a little something. People, I, I I have a hard time with compliments. I'm going to be honest with you. Hey, Florida. Hey, NYC. I have a hard time with compliments. Not saying that I get tons of compliments, but every once in a while, people do compliment me. I work in an industry. I obviously work in entertainment. Obviously work as a drag entertainer as well, and I work in acting and film and television. So I spend a lot of time on camera, in front of the camera, on stage, like where people are like looking at me. You know what I mean? And so, you want to make sure that, your hair is combed and you have on a nice outfit and that you've washed your face. And so every once in a while, I'll get a compliment or two on my appearance. Um, and while I do appreciate it, I try my best not to to live in that. Of course, I want to be presentable. But I guess I have some like insecurities. We all do, right? With receiving compliments and not receiving them or like looking a certain way. Hey, Devin. And so I I try to just keep it private. Like whatever I'm going to do, hopefully people will like it. One of the things I've noticed though is I've received compliments from time to time on my skin. And while I do appreciate that, this is also an area that I have insecurities. I think a lot of us do. I certainly have things that I try to deal with, and little issues that I want to confront or face, or things I want to fix about my skin, and tend to. And as a person of color, I have a skin journey, whether it's the color of my skin, the depth of the melanin, the effect of sun. Um, Also, as a person who has grown hair out of their face, shaving sort of presents a whole nother story to the skin. In my opinion, I remember, getting razor bumps at a certain time and how that changed the smoothness of my skin and the texture and also even the color, in certain ways. And so that was always something that I was really, it was disconcerting to me, to say the least, as someone who spends a lot of time on camera, on stage. Um, and then being a trans woman and trying to at least be identifiable as a woman, so for safety purposes, and knowing that there's a sort of a stereotype that women do or should have soft skin and all of clear, perfectly clear, this and that. um that presented a whole nother set of considerations for me. And so I've had a journey, as we all have, with our skin. And you know, being someone who's of trans experience, trans woman, um, and dealing with the growth of facial hair, or, razor bumps and all these things that I talked about, that can kind of rub up against, personally for me, my gender dysphoria, you know. And so finally seeing a dermatologist after dealing with this and sort of grappling with a lot of these things for years was something that I decided that I wanted to do, and it seemed like the first couple dermatologists that I went to, I was just sort of being shuffled through. You know, a lot of times, a lot of us have this experience in American medical sort of experience where have an appointment, and sometimes you can go in and out of that appointment and feel like the doctor didn't even look you in the face or in the eye. And I've had that experience in the past. Um, and so, yeah, I can see in the comments your Melissa saying I'm the same way. I'm trying not to compare myself to others. Yeah. Minty says so true. Women are held up to such high standards. And Devin Smith says, uh, I when I first met you at Jacob Javits Center, it was Pride. Yeah, it was Pride Week. I'm sure it was. I probably did not sleep that week, which does not help your skincare regimen. I'll tell you that. Um, but my experience has always not been the greatest. I never felt like I was able to connect with a lot of my healthcare providers, especially the dermatologists or two I went to. And I was doing a special event with my friend Caswell, Pride in Dermatology, which is a fabulous event which brings together the queer community and dermatologists. And I think that there's a lot of issues that folks in the queer community deal with and face, especially when it comes to the medical system and including dermatology. And and so I was really happy to meet someone who spoke that day, and we exchanged information, and I went to see them, and it's the rest is history. So I'm bringing on my someone who I see for dermatology, and to answer some questions because I think there's a lot of people who do have certain questions, and so I'm going to introduce them and bring them on right now. Uh, and we are going to be answering questions, so you can submit them here in the chat. We also have some questions that were submitted on Instagram, and so if you submit a question, just want to let you know we will do our best to get to you. Dr. Karan Lal is a double board certified dermatologist who is such a sweetheart, and you've probably seen me reposting their videos on social media, just FYI. But they are the only, I'm trying to get this bio together, double board certified adult, pediatric, and cosmetic dermatologist who is the only dermatologist in the country who's fellowship trained in, oh my gosh, I'm going all over the place with this. Here, only fellowship trained pediatric and cosmetic dermatologist in the country. And he treats everyone and a ton of celebrities too. And he is most known for treating skin of color, that which I do have. And so I'm very excited to welcome I should probably show one of his videos. Is that okay? Just give the thumbs up, Dr. Lal, if I can just like show one of your videos first before I bring you on. I think that's always fun. I'm gonna bring I'm gonna bring up Dark Butt because I think that's fun. Can I play that for them? Okay, here it goes.
Hey everyone, it's me, Dr. Lal. Happy Sunday. Do you suffer from a dark butt crack? Do you know why you have a dark butt crack? Let's talk. You may have a dark butt crack because of psoriasis, a frictional dermatitis, especially if you're doing sit-ups all the time. I call this sit-up butt crack, and yes, I've had it before. It could also be from insulin resistance, a condition called acanthosis nigricans, or even gluten insensitivity. So here are some tips for you if you have a dark butt crack. 1. Make sure you see a board-certified dermatologist to rule out any other underlying medical conditions. 2. If you do sit-ups, make sure you do them under a padded area so that you don't get that friction and irritation. Consider lactic acid-containing moisturizing lotions, such as amlactin. Follow more to learn how to treat buttock intergluteal hyperpigmentation.
Dark butt. I mean, my butt is dark, but I actually don't know what my butt crack looks like. How would people even know that? Their friends would have to tell them.
friends or other people that they interact with, on a more personal level. Um,
Okay.
or or you could be at the gym, you know what I mean? And when you're at the gym, you get a little slip, and everyone, takes a look and is like, "What's going on over there?" And it's funny, we see it all the time. People don't know it. I see it in whites, I see it in blacks, I see it in Asians, I see it in a lot of people, and it's usually people that are really active. And for a lot of people that don't know, people like to scratch their butt. It's just the truth. People just do. And so that's another thing that that skin is so sensitive, and it's prone to hyperpigmentation from just scratching. So
Mhm.
it's really important to remember to moisturize in these areas, because people don't, and there's a lot of different types of moisturizers. But the important part of the story is to make sure that you don't have something serious. And often, for example, skin of color patients, black patients, get misdiagnosed as not having psoriasis because it's a very moist area, so you don't see the scaling that you typically see with psoriasis. And
Mhm.
so, getting the right diagnosis will give you the right treatment. And so I always tell people, just don't assume that it's from X, Y, Z. You really want to get down to getting to the nitty gritty, getting a diagnosis, and figuring out what is causing that.
I really do appreciate that. Listen, my main doctor prescribed me not to be talking about all the things that I take, but I have used lachydrin or amlactin lotion before, cream lotion, and it is like the miracle lotion in my opinion. Um there's only been 2 moisturizers, lotions, moisturizers, creams that I've ever used that I've said, "Oh, this is, like, life-changing." The first one was a lotion that was prescribed. I had gotten some burns, and my doctor, my pediatrician prescribed, something called Silvadene. Have you ever heard of
Yep,
that? Do they still make it? And I was
yep,
like, "This is like the cream of life."
yep.
Like, it got rid of my pimples. I was like, "Pimples?" They weren't even prescribing it for that. And then lachydrin or amlactin, this is it like a hydrolac? What is in this? It's some
So
kind of acid.
yeah, so there's lactic acid, and people often think if you're using a lactic acid, it's very strong because it's an acid and it's going to burn. But lactic acid is one of those alpha hydroxy acids. It actually comes from like milk and spoiled yogurt. So I don't know if you know this, but the first chemical peels that were done in the world in history were done by Cleopatra. And what she used to do is she used to use spoiled milk on her skin, and spoiled milk, the milk, as it gets spoiled, it ferments and it creates acid. That's what gives that sour milk taste. And lactic
Oh
acid is
yeah.
essentially that. And so lactic acid is not just an acid that exfoliates the skin at a very microscopic level. So it's not going to cause peeling of your skin in sheets, but it also has
Right.
natural properties that allow it to be a moisturizer. So it's really great to use on the buttock area, especially for people that have a lot of dark spots, even if it's not just in the crack, but people that get a lot of like, friction related, or they have pimples on their butt that leave dark spots. It's a great way to help start moisturizing that area and help exfoliating some of those dark cells.
I see that. Now I'm also seeing that on just FYI on our Instagram. It looks like the we're facing the wrong direction, but that's okay. We'll be able to, for those of you that are on Instagram, you can go to, you can catch me on go to my other channels if you want to ask a live question. We will be checking the Instagram questions every now and again. But if you want to interact and see us not sideways, then you can just go over to either my Twitch or my YouTube or my Facebook. And we will be reposting this on Instagram a little bit later. So you'll be able to see this and hear what Dr. Lal has to say. But if you have a question or something and want to interact and you don't want to turn your head, I'm sorry, I don't know what's going on with the this signal. It's something crazy. Somebody trying to get us, honey. But it's a live show and the show must go on, so we're just gonna keep moving forward. That's really good to know. I can't believe Cleopatra used to use spoiled milk on her, excuse me, on her face. I
Yep.
I mean, I'm feeling it. And it when I tell you, when I put use this, it gets rid of the rough. It
Yes, it
just
does.
it in 10 minutes the acid is working. And it's like, oh, I've got soft elbows. I would never have classified myself, categorized myself as somebody who has soft elbows. When I put that lotion on, I do.
Yes.
Um, yeah, so it's brilliant. Well, I want to just go right through and as a dermatologist, what are some of the major things? Now, obviously, you create a lot of content. People can follow you if you're watching on Instagram now. It's obviously this one right here. Um, are your socials all the same on across the board?
Yeah, my socials, I'm mostly on TikTok and Instagram, and my handle is at Sir Dermsalot, SirDermzalot.
Yes, and we can see it on the screen right there.
Perfect. Yep,
Mm-hmm.
that's me. And the reason why I started creating content was because I just got a lot of questions from people, and it shocked
Mm-hmm.
me and blew my mind how many people don't have access to medical care. And a lot of people on social
Mm-hmm.
media are very shy from giving medical advice. And I think I understand why people think that way legally, but also from an ethical perspective, as someone who's taken a specific oath, I try to at least give people enough information that is safe and point them in the right direction. And so, I try to
Mm-hmm.
come up with common things that come up in my clinic and make videos on them because these questions come up over and over again. It's not like this is a one time thing. And
Mm-hmm.
even we have some questions here, like
Yeah. We're
hyaluronic
gonna put those up in a second. I'm gonna put those up in a second. If
acid.
you want to ask a question, enter it into the chat and we will get to your question in just a second. And we're gonna answer all of them. So get ready, y'all. But that's why you decided that you wanted to start creating some content. Your videos are like entertaining and funny. And I want to ask you one thing. Who is this bird? What's your bird's name? This is a pet that you got recently when you moved out to Arizona, right?
Yeah, so when I moved to Arizona, I decided to adopt a bird, and his name is Maui. He's a sun conure. He's very pretty, but
Uh-huh.
as we know, the pretty men are always, the loudest. So he's loud.
Shade. No.
I am. I'm very shady because he's loud. He's always in my face. He always wants the attention. And he's so pretty. I just can't not give him the attention. And he always wants to be involved. He's always, listening to the skin stuff. And believe it or not, he uses some of the products that I use too. So,
How so? What do you mean?
like when I shower, he often showers with me, and I'll use my La Roche Posay cleanser on him, and I'll use a little moisturizer on his feet, and a little oil on his beak.
Uh-huh.
Yep, because I got to keep him looking
Shut
good.
your mouth.
Yep,
So, I mean, obviously birds have skin.
yep.
Um, and so your bird likes to get wet as well. They do?
Yep. He bathes with me every day.
I can't even believe it. That's so wonderful.
Mhm.
I'm jealous. I need a bird then because I ain't got no anyway. Let's watch another one of your videos. Like what are some like the I we pulled some of the videos. I'm gonna say that are these sort of the top three things. Let's watch some of the videos that you have pulled up and we can talk a little bit more about some of the other conditions or things that concerns that people have. Let's talk about gynecomastia because my last pep talk was with a fabulous creator who is a cisgender heterosexual male who is a gym person, a fitness personality, and he has gynecomastia and also I guess felt a sense of shame about it, and he creates content that is encouraging and uplifting to people who deal with gynecomastia. Talks about ways that people can sort of move around and either if they want to wear clothing that'll make them feel more comfortable, and he's also talked about like contemplating surgery, and really is sort of collecting a community of those who deal with gynecomastia. And so I want to play your gynecomastia video in honor of him.
Hey everyone, it's me, Dr. Lal. Today let's talk about man boobs, also known as gynecomastia. While I'm not a plastic surgeon, I've suffered from gynecomastia. I've had my gynecomastia treated, and I can tell you all about it. And I do treat the skin laxity or the loose skin after gynecomastia surgery. Gynecomastia is enlargement of male breast tissue, not fat. It can happen typically during puberty, and as men get older, it can be due to certain medications, including alcohol, including finasteride, antidepressants, and marijuana. Sometimes it can happen in one breast, sometimes it can happen in both. It's often asymmetrical, sometimes painful, sometimes you can actually feel a lump behind the nipple. It can cause a lot of social distress, and it has for me. That's why I had surgery done. Surgery is curative. Now, there's different approaches depending on how much breast tissue you have. Some people experience some looseness after the surgery. That's where I come in.
Oh, there it is. Okay, that's the end of that video. So you did have gynecomastia surgery, as you mentioned in the thing. Is there ways that people can are are there non-surgical sort of ways to address gynecomastia?
So it depends on, so there's true gynecomastia, which is when you actually have enlargement of male breast tissue. Often you can tell
Mhm.
because if you palpate the breast or feel the male chest or whatever, you should feel a mass inside, like a lump or a clump of tissue. That is male breast tissue. A lot of people actually have pseudo gynecomastia. Pseudo gynecomastia is where you don't necessarily have enlargement of breast tissue, but you have a lot of fat. I had both. Most of the patients that I see have pseudogynecomastia, which is where they are obese or overweight and they have man boobs, and that people think just because you have man boobs you have gynecomastia, and that's not the case. You can have one or the other or both. I had both because I was 300 pounds. I was big, so I had both gynecomastia and pseudogynecomastia. For pseudogynecomastia, if it's just fat, you can do liposuction, which I actually do in the office. And there are some forms of non-invasive radiofrequency microneedling treatments that you can do for that as well. However, if you truly have breast tissue, meaning behind your nipple, you feel that there's a mass or there's lumps, or it gets large, which often happens from exogenous hormonal use, um, then or marijuana use or certain medications, then the next best step really is surgical, and surgery is the best. And it's actually very good. Like I had mine, then you can't even tell because they take the tissue right underneath the nipple. So they make like a little crescent moon shaped incision. They take out the
Mm.
breast tissue and they stitch it up.
I I dig that. Okay, okay. I think it's really interesting because this the creator Stazzy Fit, who I did the gynecomastia conversation with, his inadvertently sort of crossed paths, or his audience intersected with trans men, uh and there are certain trans men who top surgery is obviously an option for trans people, especially trans men, and having a flat chest, or like what people would say is a the absence of breast tissue, what people would call like a masculine chest, if that's what they want to call it, is a concern, or is a goal for some trans masked folks. And so surgery is obviously an option. A non-surgical way that some trans men uh, deal with their breast tissue, or sort of figure out how they're going to move about the world, is with use of a binder or something to like hold down the breast tissue. And so those two worlds sort of intersected. It's really interesting to hear people talk about. Gynecomastia was just something that, like, when we were kids, I did not hear people. You would just the only other people addressing it would be people teasing on the schoolyard. That was
Yes.
it. I never heard anybody talking about it, addressing it, offering options. Just never even heard of it. And so it's really great to hear you talking about it. Let's move to some questions, shall we? I'm going to go back up to the top to Melissa. Alyssa Barclay. I just went and saw Madonna at the Barclay Center. Melissa says, I have that issue with growing hair on my face as a woman. It's very hard because it makes me really self-conscious. When we put the questions, I'm going to show like the first couple sentences of the question. Um, and so Melissa says, what's the best way to get rid of facial hair? Because I know when I was young, I started shaving it, and that was the worst idea now because it comes even worse. Can you address facial hair on anybody who doesn't want it? Male, female, however, is there a difference between facial hair and someone's sex or gender?
Yeah, so they're in men. Men typically have terminal hairs that are thick. Terminal hairs are hairs that are medullated. They're thicker. They're hormonally responsive. They have a hair shaft, and they're not peach fuzz. Most females have non-medullated, what we call peach fuzz on their face, and that's what a lot of people do dermaplaning for, and it's often on the sides. Some ethnicities, however, Middle Eastern, and Latin American women can get a little terminal hair on their upper lip, on their sideburns, And if you have PCOS, then it could involve your whole face, and it can, like a man's beard. And so it is different, and facial hair is responsive to hormones. And that's important to know because when people are transitioning or they're going on hormonal therapy, you will notice that their facial hair will increase. And so that's how we know that hormones play a role in the growth of facial hair. Now we'll talk about what are the options. Well, if you want something that's easy and you have a lot of peach fuzz, you can get dermaplaning done by an esthetician where you go in and they kind of like gently shave your face. It is not going to make your hair grow back thicker, which is a myth actually. The next thing that you could do is consider laser hair removal. Laser hair removal is not permanent and it is not an option for people that have peach fuzz. It will do nothing and is a waste of money for peach fuzz. It's only going to work if you have thick, prickly terminal hair like I do on my face.
That's dark colored.
Yes, that's dark. Laser hair removal does not work on white, gray, or blonde hairs and not red hair. It really only works for black and brown hair. And it's not like you can dye the hair and confuse the laser. It's because the laser is targeting the hair inside the skin, not on the outside. So you can do laser hair removal. It often takes 6 to 8 sessions. It is painful, and you may get reduction in your hair growth, which is the goal with laser hair removal. Some people get some sort of permanent result that lasts for a couple of years, but then it comes right back. The best treatment is electrolysis, which is very old school and is a dying art. People are not very, it's very hard to find an electrologist anymore. It's extremely painful. They use,
Extremely painful.
have you done it?
Yes, I've done it. I've never completed. I can't be successful with. I've had it done in certain areas, but like I have never. I'm not one of those people that said I did electrolysis on my whole anything. I just would rather just pay and go back for more laser, which is also painful, but clearly a lot less painful than electrolysis. I cannot stand it,
Oh,
but
electrolysis
it's
is,
permanent.
yeah, it is permanent. So electrolysis over time, you will get permanent reduction in hair, and it works for white hair, blonde hair, black hair, gray hair, so all hair colors, because they go in with an individual needle and they heat and they burn the hair follicle. It's extremely painful. Topical
It feels
numbing
like you're
helps.
getting electrocuted from the inside out.
Yep, that's exactly what it is. Now there are some other things. So there are some topical therapies. One is called Vanica. Vanica,
I
you
remember
was very
Vanica.
Yep, Vanica was very popular about 5 to 6 years ago, even 10 years ago, and it's expensive. It's hard to get. I often prescribe it for my patients from the Canadian pharmacy, and it over time will reduce the amount of hair that grows. And that's typically what I recommend for my patients that have peach fuzz, PCOS, are undergoing transition, don't want to do laser, have done laser and need something else that they need to do, or just someone that just is rather comfortable using a cream. So I prefer to do that. That's more of an adjunct, so I recommend that in addition to some of the other therapies. So those are really your options when it comes to hair removal right now. We'll see what the future has to hold, but for right now, I would say if you really want permanent hair reduction, you should do electrolysis. If you cannot handle that, laser hair removal is great. If you can't handle that and would rather do Vanica, you can see your dermatologist and ask for a prescription from the Canadian pharmacy. It's like 50 to 60 bucks, and it often is that much a month, which is affordable for some people. So that's what I typically recommend.
I'm going to move right on to another question. We got the questions that are flying in, so I want to try to make sure we get to all of them. That's funny. The only Michael Smith says now. I guess after watching that video, now my roommates think I have a dark butt crack, but no judgment to anyone that does. I think after watching that video, that's just so funny. If you're watching us now, I'm here with Dr. Karan Lal, who is a double board certified dermatologist. We are answering dermatology questions. If you have any questions about skincare or any type of skin or hair, because they're made of similar cells, right? Is that true?
Yeah, yeah.
Then please drop them in the comments. We will get to them ASAP. By the way, Devin Smith, I'm working on some new music right now that'll be coming out later on. Okay. So Minty says my diabetic ass is literally getting called out. Why? Did we mention diabetes?
Yeah, so actually, one of the conditions associated with the dark butt crack is acanthosis nigricans, which is that
Oh.
velvety dark skin which people can get in their butt crack area. It's
Mhm.
normal, it's common, but that just is a reminder that if you have a dark butt crack, you want to get checked because sometimes these dark things could be the first sign of diabetes.
Would that be applicable to pre-diabetes as well?
Absolutely. It's associated more so with insulin resistance, which is what you see in
Okay.
prediabetes.
Yes, yes, yes. She's familiar. Now, Melissa says, I was wondering who's going to be the dark butt crack inspector. I'll do it. Hey, I don't mind. I have tried it. It's really cool. April, are you talking about what have you tried, April? Um, the only Michael Smith says, ass acid. I love that. Um, let's keep it going. Okay. So Minty asks, is hyaluronic acid actually good for hydration, or is it just a skin trend? I'm going to tell you one thing as a makeup artist here. Hyaluronic acid, as far as I know, and I remember because glycerin was all the rage in the makeup in the cosmetic world, and then we got our hands on hyaluronic acid, um, which is it. I think is also a humectant, and so it attracts it. This substance absorbs water, just like glycerin does, and so it can make things even more juicy, like especially on your hair. But I may be wrong. Tell me, am I right? Talk to me.
I think you need to just like come work with me and see patients because you're just so smart. You're using all these big words. I can't even have a chance to show off. But yes, hyaluronic acid is actually a sugar molecule. It's not an acid like people think, like salicylic acid. It's a sugar molecule. We have it in our joints. We have it in our skin. We have it in our eyes. And hyaluronic acid essentially helps to provide lubrication. So it is a humectant, which means it binds 1,000 times its weight in water. So
Which is more than glycerin.
yes, way more than glycerin. Hyaluronic acid essentially is the secret to getting a dewy face and to getting a really nice glow when you do apply makeup. But the problem is people don't use it the right way. If you put hyaluronic acid on dry skin, all it's going to do is like suck up the water from your dry skin. It's not really going to go into your skin. So you need to use hyaluronic acid when your skin is a little wet and damp because it's going to help attract that water that's sitting on the skin and help bring it into your skin. It's going to help hydrate the skin inside. So a lot of people just put hyaluronic acid on, after they wash their face, and their skin dries off relatively quickly. But reality is, you wash your face, and when your skin has a couple of drops of water on it, you use the hyaluronic acid on right away, and you'll see it gets absorbed up. It gets like shooped in. And hyaluronic acid is
Mm.
great. It can temporarily, reduce the appearance of fine lines because it's hydrating that skin. It's safe on all skin types, including those with people that have rosacea or eczema or dry skin or sensitive skin. You just want to make sure the product you're using doesn't have any added things like fragrance or anything. And I recommend using hyaluronic acid twice a day, in the morning and at night. And it's also going to help all of your other skincare products just go on so nicely, including makeup.
I just love that. I do wash my face and then I would like pat it dry, which it feels like there's dampness still in my skin. I don't like scrub the dryness. I'll just like remove drips of water. But you're saying it's good to do when there's actually some drops of water still
Yeah.
on the top of the skin.
Yep.
Okay. I usually use it and then immediately put on a moisture, like I'll do the hyaluronic acid and then a moisturizer right away. Uh, is that my close?
Yep, that's the right way. That's called the sandwich. That's actually called sandwiching. Like it's called the hydration sandwich because after
Mhm.
people don't often understand this, but moisturizers are emollients, so they have lipids and oils in
Mhm.
them, which are very different from humectants. Humectants like hyaluronic
Mhm.
acid help attract water into your skin, whereas emollients help seal your skin off and prevent water loss.
Mhm.
So you have to kind of do the two together to get the best benefit.
I love that. Let's keep going. Come to Twitch fam. Hey, what's Twitch fam? Only Michael Smith. I don't even know. Pep is gonna add spoiled milk to her riders for gigs. You better believe I am, darling. I'm putting it. Are you saying that I need to do something to my skin? I do. I of course I always do. April says, I have a question. My skin over produces keratin in my pores and it causes bumps. How would I get rid of that problem? If you can answer that.
That's a great question. Pores are here to stay. Your pores are not going anywhere. I don't care what
What?
anybody tells you. No one can reduce the appearance of your pores permanently. Pores basically are ways your body needs those pores to get rid of oil. Okay? So what you can do is temporarily reduce them in size and help close them up. And there are some things you can do. The Biore strips that people use for their nose are great. The problem is when
Yeah.
people open up those pores, you have to make sure you put something on to help seal them. So you don't just like do that because then you're keeping all these gaps open and allowing things to come in. So I
Mm.
love the Biore strips. Do them as much as you want. They're not harmful. They're not dangerous. But you want to use products like salicylic acid, glycolic acid, because these acids actually do temporarily shrink your pores. What they're doing is they're reducing that keratin from
Mm.
becoming sticky and sticking into those pores. So regular use, and there's a pore refining serum. A lot of companies make them. Pick the one that's the cheapest, that's safest on your skin. La Roche Posay makes one. But a number of companies make a pore refining serum, and
Mhm.
they often have either glycolic acid or salicylic acid, and these
Mhm.
acids are truly great at helping preventing those pores from getting clogged. Also, ice facials are great. So a lot of people used to see one of the Hadids. I don't know which one is it, Gigi or Bella. I always confuse them. Who's the model?
Mhm. I'm not sure.
I think it's Gigi Hadid, but she would like dump her face in ice. Dumping your face in ice actually does temporarily reduce your pores. So if you're someone that's really worried about pores on your nose, every night before you go to bed, after you wash your face, take a cube of ice and rub it on your nose. It will help shrink those pores so they don't accumulate gunk
Mm.
overnight. So that's another tip.
It does seem to happen pretty quickly. We're gonna do rapid fire with the questions here, so you might have to give the truncated answers.
Okay, I'll
Um,
check it.
Wild Noggin says, "How can I reduce the androgens in my scalp without using medications like Propecia?"
Excellent question.
Mm.
There are things I need to stop saying excellent question because it uses time. But there are supplements. Supplements like saw palmetto, things like pumpkin seed oil. These are supplements that you can use that have shown to have some weak anti-androgen activity, and they're supplements, and they have some data behind them. Those are great. Other things you can look for are things like Nutrafol, which have natural DHT blockers. That's another thing you could consider. Also, for someone that doesn't want to take a systemic medicine, we can now compound these medicines in topical formulations. So you can use topical Propecia, and you don't have to use the oral version. So that will save you from getting those side effects.
I love that. Next, the only Michael Smith says, "I have flesh color bumps on my forehead. What the hell is going on? Is my forehead trying to communicate with in Braille?" Okay, now's the perfect time for me to give the the disclaimer that this content is for informational purposes only and should not be used as a substitute for professional medical advice. Obviously, this is professional medical advice, but you need to speak with your medical professional or consult with them or healthcare provider if you are seeking medical advice for a specific situation. Um, but please, now, what are these flesh color bumps?
So
You can't really
the
diagnose, but go ahead.
Yeah, it could be a number of things. Most commonly, when I see flesh-colored bumps on the forehead, if it's not milia and it's not blackheads or whiteheads, it's most likely something called pityrosporum folliculitis, also known as yeast acne. Super common in
Ooh,
people that are oily
okay.
and people that work out a lot. It's very common also in black women that especially put a lot of oils on their scalp, and in Indian women that put a lot of oils in their scalp. So if you're someone that
Mm,
has dandruff or an oily scalp where you apply a lot of oils or you're using a lot of occlusives, that could be doing that. Simple things you can try are over-the-counter shampoos that contain ketoconazole like Nizoral, selenium sulfide, Head and Shoulders with zinc pyrithione. That's where the Head and Shoulders face wash became popular on TikTok. It's because you're treating that condition. So that's something to consider.
Kate, Kahuki, I think, says, "I had bad acne as a teenager, which resulted in a lot of scarring in my I'm in my late 30s now. Is there anything that I can do to help minimize the look of the scars at this point?"
Yeah, acne scars are really hard to treat, but they can be done. I tell people we're not going to get your skin to be 100% better, but we can get you to 80%. Some of the easy things you can consider are microneedling. Microneedling is where we use a special type of motorized pen that has microneedles that punches holes in the scars to break it up. That's a great treatment. Radiofrequency microneedling is where we use microneedling plus heat energy to break that up. Other things that you can consider are certain lasers like a Fraxel device, which is a type of laser that can help break up scars. Also, sometimes we use certain fillers like Sculptra, which helps to
Mm,
stimulate collagen in those acne scars. So it can be done. We can help you. It'll get 80% up to 80% better. It just takes time, patience, and of course money. But if it's something that bothers you, I highly can find you a good dermatologist that can help you out.
Listen, I've seen a trend, especially on TikTok, of people using these microneedling things at home. What are your thoughts about that? These little tiny like wheels that people would,
Yeah,
scrape across their skin.
it hurts. Okay. So it's gonna hurt. It looks like it's painless, but it's gonna hurt. The needles that you're getting are often 0.25 millimeters, which is not that deep. So it's not gonna help those scars as much. It might help like give your skin a nice little glow. The problem is when you're using these microneedles and you're introducing bacteria in your skin. So if you're not someone that understands aseptic technique, meaning you're using, antiseptic on your skin, antiseptic after each roll, and also these rollers are going to dull as you use them over time, and so it's actually going to cause more harm than good. So I would say avoid that and not do that because I don't think that that's helpful. You're better off using a topical retinol, which would likely give you the same results and is safer.
Mm. All right, honey. Uh, Sig on fire. Sig's on fire says, "Are skin tags bad? Are they benign up to a point?"
Skin tags are not bad. Skin tags are annoying. Everybody hates them, and often they're due to a couple of things. Friction. So a lot of people that wear necklaces on their neck will notice that they get little skin tags. And it's because your little skin
Mm,
cells are getting balled up and forming these little growths. So it can happen due to friction. It can happen due to obesity because when you're obese or you're overweight, you get more friction between your skin. It can also be associated with things
friction.
like prediabetes. So they're not bad. They can be treated. They're just annoying. And please do not pull them at home because oftentimes people will pull them. But I've seen things that were called a skin tag that turned out to be a skin cancer. I've seen a skin tag
Mm.
that was taken off by a patient that actually turned out to be a wart. And so get a diagnosis, and do it the right way.
Wow, that is, yeah, that's sobering for to say the least. Coconuts and cinnamon says, "I'm 43, 6'2", 190 to 97, and I have acne scars that I hate. Do you?" Okay, so we already talked about acne. Um, Let me go through. Okay, so hopefully you got that. Coconuts and cinnamon. I love that name too. I appreciate your April says, "I appreciate you." Thank you so much for the message there. Let's go back and watch another one of your viral videos because they're so entertaining. Which one should I show?
Ooh, let's talk about the hair loss, alopecia in the beard.
Is that the patchy beard? Okay, here we
Yeah.
go, y'all.
Hey everyone, it's me, Dr. Lal. What do you see here? You can see that there's actually some hair loss within this mustache. Believe it or not, hair loss, especially moth-eaten hair loss like this on the scalp and the beard, can be associated with syphilis. While it's not the most common cause, I have recently caught men with isolated hair loss in their beard who ended up having syphilis. From 2020 to 2021, the incidence of syphilis went up by almost 29%. Also, gay men made about 50% of the cases of syphilis in males during that same time period. The incidence of syphilis in women during that time period was about 55%. What this means is syphilis is back and it's here to stay. If you have isolated patches of hair loss that are not responding to treatment, make sure you get worked up for syphilis.
Syphilis. Now, is that like that's a possibility, but obviously like there are other, I would
Yeah.
assume other.
Typically, when we have patchy hair loss and we see patches, we think of alopecia, also known as alopecia areata, which is a type of autoimmune
Mhm.
hair loss, which is more common. But I will tell you, I have seen so much syphilis in the past 2 years. It is crazy. And
Mm.
in the gay community, post-exposure prophylaxis with doxycycline has helped. But it's just a reminder that you really want to have, protected sex because you shouldn't trust anybody, and people don't realize that when you take PrEP, it doesn't protect you against those types of infections. Also,
Mhm.
syphilis is one of those scary bacteria that it can stay around in your system for a very long time. It can lead to neurosyphilis. Neurosyphilis is when it essentially eats away your spinal cord, and you can get dementia and muscle weakness and
Oof.
paralysis. So don't underestimate syphilis, and don't think that because it's easily untreatable, you can just go out willy nilly and do whatever. You really need to make sure that and it can be very subtle. You'll be shocked. I've seen things that were called psoriasis and were treated for psoriasis and they never got better, and it was syphilis. We call syphilis the great
But
masticator until
were
it's done.
those? Do you think that those types of situations are not catchable and treatable for syphilis itself? Like if people get screened for STIs?
If you're getting screened routinely, every 3 months if you're that active, which most people, regardless, should be doing anyway, you should be okay.
Hmm.
But like I said, it takes a while for syphilis to even get recognized in the body. So, say for example, you only get tested twice a year, that may not be a good thing because you may miss the opportunity to catch that positive result until your next test at 6 months.
Getting screened on a regular basis, if you are a sexually active human being,
Yep.
is definitely a good idea. I regular basis for me is not annual. It's not even every 6 months. It's like Dr. Lal said, every 3 months, because that's great. And if you have a clinician that'll test you even more frequently, then I'd say go and do that. Um, come on, Miss Syphilicia, says coconuts and cinnamon. Listen, you all, I hope we answered all of your questions. Of course, you can follow Dr. Lal on social media if you have any other questions. I see him answering questions all the time on social media, but most importantly, treating patients. And so if but if you want to connect, I think you should follow them because there's always something. Like I wasn't thinking about dark butt until today. Now we're all thinking about dark butt crack.
Yep.
You see these videos and it helps us start to think, and you may actually catch something, a symptom or a condition or something a question that you've always had that's inadvertently answered on Dr. Law's social media. Are there any to go? I know we talked about the lachydrin. Are there any other products that you want to highlight that people that would address just sort of everyday questions and conditions that people and concerns that people have?
So this is great, and so I gave Peppermint some products. I want everyone to know that you should not be spending more than $30 on a skincare product. It's just not worth it unless it's a very good sunscreen. So for the average person, my favorite cleanser is the Cetaphil Gentle Skin Cleanser. This Cetaphil Gentle Skin Cleanser, it has no fragrance. It has like less than 20 ingredients. It's amazing. You can use it on the face and on the body. It actually hydrates your skin. You don't even have to wash it off. You can just apply it and wipe it off, and it will still hydrate your skin and remove grease. So that can be used 1 to 2 times a day. And then another really good thing to consider is a moisturizer. The moisturizer that I like is by Uriage. Uriage is
What color is it? Is this it?
it's like white and blue. It looks like a pump bottle. Oh well, we could talk about this too.
Okay.
So okay,
Oh,
yeah. So this is the Uriage moisturizer that I like. It's $28. It's almost 14 ounces. It has lipids in it. It is so
mm,
gentle, super affordable, and it has thermal spring water, minerals, antioxidants, and it's the one that I use all over my body. I use it on my hands all the time, and I think it's one that doesn't get a lot of attention, but it is super popular in France, and it's super affordable for a luxury moisturizer. Next, I love the Cetaphil collection. It's a new collection. It's their Healthy Renew collection. It has peptides in it, and it includes a face serum, an eye gel serum, a day cream that has an SPF in it, and a night cream. All of these products are super affordable, and they have peptides. Purified peptides help build collagen. They help hydrate your skin. They help renew your skin cells. It's great for brightening and toning your skin and for firming your skin, and they can be used in all skin types. These products do not have fragrance in them. In addition, this is great for people who can't tolerate a retinol or retinoid. Peptides are the retinol alternative. So this is great for my people
mm.
that have very sensitive skin and just cannot tolerate the peeling with a retinol. Okay, vitamin C. Listen, all of our skin of color people on here, we all need to be using vitamin C. This is going to help with under eye hyperpigmentation, melasma, dark spots from pimples, dark spots from acne scars. But the problem is a lot of vitamin C serums are not stabilized, and a lot of them come in these dripper bottles. Every time you open that bottle, you're going to oxidize some vitamin C and you're wasting product and you're using something that's only going to irritate your skin. I love this product by Naturium. It has vitamin C in it, and and vitamin E, and it comes in a little pump. So it's not going to get oxidized because it's not exposed to air. Super affordable. You can get it at Target. And it's, again, great for all skin types. And I recommend you use this every day in the morning after you wash your face, put on your hyaluronic acid. This is the next step. Then put on moisturizer, then put on sunscreen. Okay, now for those, everybody, like I said, should be using a retinol. After the age of 25, you should be using a retinol because we lose 1% collagen every year after that. Retinols are going to help tighten your skin, firmen your skin, help those fine lines, prevent and treat those dark spots. And you can use this every single night. A pea-sized amount to the face and neck, every single night is going to keep you looking youthful. You can also put on your décolleté if you're someone that has a lot of wrinkling on the décolleté, on the back of the hands. This is fragrance-free by Neutrogena. It's one of my only favorite products from them. And like I said, it's super affordable, and it's often on sale at the pharmacy. Lastly, someone brought up Elta MD. Elta MD is okay. I just find it's very thick, and I don't like their technology. My favorite sunscreen is the Color Science Flex sunscreen. It has multiple shades. It has fair, medium, tan, and deep. We can't just assume tint is tinted, right? We all have different shades of tint in our skin, and so we need different tints of sunscreen. This is, and I will tell you, the best investment. I think it's like $50. I can't stress to you, you will stop using makeup because you won't need makeup. It literally emulsifies into your skin and matches your skin color. So I use a medium.
What?
I get so many compliments, I cannot even tell you. And all I do is use this every morning. Amazing. So I would recommend finding out, what your tone is. I'm a medium. I think Peppermint, you might be a tan. They have a nice deep color as well. So you can kind of find it. You can change the tint according to your baseline tan. Say it's summertime and you're a little bit more tan, but you're fair, you can get the medium color. If you're someone that is Latin American and you have a deeper brown hue, the tan is going to do great for you. If you're black and you have that beautiful skin, I have a lot of my friends that are Nigerian and they use the deep. I'm telling you, it's like having a filter on your face all the time.
I'm getting it right now
And also,
at this.
I'm gonna send you some. Also, the beauty of this is it has iron oxides in it, which means it's gonna block you from getting damage from blue light. Blue light is on the computer, on the phone, all these things that we work in front of, and all of these things actually make hyperpigmentation worse in dark-skinned people. So not all sunscreens do that, but this one does. It also has antioxidants in it. I'm telling you, you will be addicted. It's the one addiction. You just watch. Just wait for the compliment. I'm telling you.
I believe you. Oh my gosh, that was great. I'm going to take this picture off the thing. Dr. Lal, thank you so much for having this conversation with me. It's really, really good. I think one of the things it's sort of I've always heard people talking about their dermatologists, and it did feel like when hearing that, I always thought this is just something for people who can only access it, people who are rich, people who I had only in my childhood happened to hear like white folks talking about skincare and not really hearing folks of color talk about it. Now, I know that there are some differences and maybe some perceived differences in skin and skin of color with regards to melanin and even some of the different traditions that people in different cultures have, which might result in different levels of concern or need. But we all have skin that needs to be taken care of at the end of the day. And hearing you talk about taking care and addressing concerns and issues for skin of color was just wonderful for me, because there's a lot of things that we deal with, that I've dealt with, that just, weren't addressed in the general conversation when it came to skincare because they weren't being delivered by people who were of color. But I know you treat all types of skin, but I just wanted to mention that. So if there's anybody of color in this chat, make sure you go and follow Dr. Lal for more information. Thank you so much for going live with me. This is great. It's been a wonderful time. We have to definitely do it again.
Yes.
But for those of you who are watching, thank you so much for joining. Please feel free to follow both myself and Dr. Lal. If you're following one or the other, make sure you're following both of us so you can keep up and watch the next video. I have an awesome video coming out soon, an awesome live chat with another medical professional who does gender affirming care. And I'm really excited about that conversation. But in the meantime, you all are wonderful. Dr. Lal, thank you again. I will see you on the internet.
Yes, and I will see you soon in person too. It's going to happen.
It's true. It's true. All right, everybody. Thanks so much.